parent isn't part of the solution. They are part of the problem.
The whole attitude around trans children in our educational system we're working towards should be and is becoming that it's the safety of the child that is first and foremost their paramount concern, not the safety of the parents or the parents' prejudices or thoughts.
What we're talking about here is not the adult trans community taking control of its own destiny, but the adult transsexual community trying to intervene in the destinies of children who aren't even their own.
I can be jailed if I use male pronouns for James or show him in public as a boy.
I wasn't able to prevent my daughter from receiving cross-sex hormones, and her life is irreversibly changed forever.
We are living a parent's worst nightmare.
I no longer have say in my daughter's medical care, anything. I have no access to her records, and that essentially the state is now taking over the medical care of my daughter. They say I have to use only the pronouns that she wants. I have to affirm. If I refuse any of these things, it's now criminal violence. And I end up with this protection order that says, if I don't do this stuff, I will be thrown in jail.
A conservative law firm is suing Madison's school district.
I'm not aware of any other example where a district takes an issue as significant as this and as controversial as this and takes it out of parents' hands.
A 2018 policy teaches staff how to support transgender students, allowing kids to change their gender identity in school without parent approval.
He said, "Mommy tells me I'm a girl." And I sent her a text and said, "Are you actually telling James that he's a girl?" And she's just replied simply, "Yes." I consider this to be child abuse and the sexual mutilation of children on an industrial scale. I can't believe that a mother would do this to her son. She's saying that it's psychologically abusive to James, that I will not affirm his fake female identity. And she has gone to court saying that I have to go to a transgender education class if I don't attend the class or achieve satisfactory marks. Then I can be jailed for contempt. I can be jailed if I use male pronouns for James or show him in public as a boy, or if I cut his hair in a boy's hairstyle.
A 17-year-old Hamilton County boy looking to continue his gender transition from female to male. But his fight for acceptance, specifically from his parents, wasn't easy. The parents stopped his therapy at Cincinnati Children's and wanted him to see a Christian therapist.
The belief that hormone therapy or sex reassignment therapy would help patients who have gender dysphoria is based on hope, not science.
Hamilton County Judge Sylvia Hendon awarding custody to the teen's grandparents.
Canadian father Robert Hoogland's now 15-year-old daughter has been receiving testosterone injections by court order. According to the courts, Rob and his wife had to affirm their daughter's new gender identity. Rob was told that if he tried to dissuade his daughter or referred to her as a girl, he would be considered guilty of family violence. Justice Francesca Mazzari convicted Rob of family violence for using female pronouns. To make sure Rob didn't refer to his daughter as a girl again, Mazzari signed a protection order authorising the police to immediately arrest Rob without warrant if he was caught referring to his daughter as a girl or with female pronouns. Rob kept quiet through the long months of 2019, hoping to get his daughter off testosterone in the Court of Appeal. But in January of this year, the highest court in British Columbia declared that Rob's daughter should continue taking testosterone.
Grade 7 is where things really started to change. And when she graduates from grade 7, I discover, unbeknownst to me, that she has changed her female name to a male name. And like every other parent, I did not know what was going on in the school system at that time. I trusted the school system and the school counselors that they were getting things done with my daughter that were of her best interest. It comes out later in court affidavits that it was the school counselor who did this. She was going to go by this new name in the high school and special bathroom privileges and all the other stuff they do in the schools to accommodate someone who thinks that they're not what they are and they're the other sex. Dr. Wallace Wong was brought on by the high school. He comes out at the end with his assessment and says, your daughter is a boy, but a gay boy. Apparently they were going to start pumping her full of testosterone and cross-sex hormones and lupron. I'm reading through this form, and it's saying that there is an elevated risk of heart disease, heart attacks, all these different types of cancers. It stunts your growth in its spot, so your body does not go through puberty, which means, you know, your bone density stays where it is. On top of that, it says you're going to be sterile. Isn't that alarming enough? And then it goes on to list other things, such as we don't even know what the risk factors are. It's an experiment. I no longer have say in my daughter's medical care, anything. I have no access to her records, and that essentially the state is now taking over the medical care of my daughter. Just imagine being a father and you've got a perfectly healthy daughter, nothing wrong with her. And you're told as a father, you can't do anything but cheerlead from the sideline, affirm all this nonsense, as you're watching a perfectly healthy body being destroyed. I wasn't able to prevent my daughter from receiving cross-sex hormones, and her life is irreversibly changed forever.
There are laws in Oregon where children as young as 15 can get taxpayer-funded sex changes without parental consent. You can't have an aspirin at school without parental consent. However, a student could make these life-altering, permanent decisions without their parental knowledge.
The Madison School District, if a student expresses that they're transgender and wants to be called by a different name, the staff and teachers will call them that name so they feel supported, but they don't notify their parents.
Luke Berg is representing 14 Madison parents who feel their rights are being violated by being kept out of this big decision in their child's life.
Effectively, what this is doing is taking a very significant and major life and healthcare related decision and telling students, you have a right to make this totally independent of your parents, and we're actually going to help you hide this from your parents. And some parents who know their kids far better than the district does might, instead of an immediate transition, want to help their kids learn to find comfort with their body, if that's at all possible.
The state does a lot to protect your children medically, and there's a lot of things the state prohibits your children from doing. Your child can't drink, child can't vote, probably can't buy themselves cough syrup at the pharmacy, probably can't get Tylenol at school, and yet your school is talking to your child about their gender behind your back.
What we have set up is, beginning in our schools, we are lying to children about their sexuality, disrupting their normal cognitive development, confusing them, and then reinforcing that confusion.
Many of these kids were on social media and YouTube watching videos with these groomers out there teaching them how to get testosterone or how to get pills or how to talk to their doctor or how to convince them that they are what they are to get these medications.
Despite adolescents' known tendency to engage in risky behaviors, poor impulse control, and failure to see or appreciate long-term consequences of their choices, the immediate desires of gender dysphoric youth are deemed sufficient for them to consent to potentially irreversible medical interventions, even when their parents object.
You have a child that's fully normally functioning, healthy, has an interior anxiety that they express as a belief about their gendered self, but it's an interior wound. They're otherwise physically healthy, and yet you're proposing radically altering their bodies without the consent of their parents.
Anne Marie Calgaro is a concerned mother. When her son was 15, he decided to transition into a female. She says St. Louis County and other agencies have disregarded her parental rights and started treating her now 17-year-old child as emancipated without her consent. The school district and St. Louis County Public Health and Human Services have usurped Calgaro's parental rights. The state allows children to be able to get this type of treatment without officially being emancipated from his or her parents.
I love him unconditionally, and I mean that unconditionally.
They are financing and prescribing dangerous hormonal drugs and prescription narcotics to a minor without his mother's knowledge, involvement, or consent.
Anne Marie is the mother of a minor child who, without her consent and without court order, has been able to get government funding for an elective medical procedure from Park Nicollet to change his identity from boy to girl.
We are living a parent's worst nightmare. He gained the notice of emancipation through a legal aid clinic, a Mid-Minnesota legal aid. They never contacted me or asked me any questions. The information that he did give the legal aid clinic was all false. The research that I've done on these hormone replacement drugs, they can cause sterility. Meaning if he changed his mind later in life, he would never be able to have biological children.
You know, what is the diagnosis of transgender? It's what this child thinks. So we're taking the opinion of a young adolescent who's not able to vote, not able to drink alcohol, not able to drive in some states, not able to join the military, and we're giving that child the permission to say that they need this medical treatment, that they're in the wrong body.
It is incredibly unethical to expect that a teenager or younger has the cognitive ability to consent to drugs and procedures that could wipe out their fertility and put them at risk for deadly diseases in the long term.
My ex-wife, Ann Georgelis, she began telling my son that he was a girl. My son was saying, "Mommy says I'm a girl."
You're a boy, right?
No, I'm a girl.
Who told you you're a girl?
Mommy.
She chose his 5th birthday party to be his coming out party. And he showed up to that party in a dress. And she began to socially transition him, is what she called it. I just call it cross-dressing. She began cross-dressing my son, and he hid under a table and was very embarrassed, but over time she's gotten him over that. And then she registered him school that year as a girl. All of his authority figures at school right now, his teacher, his principals, the librarian, the school police officer, the lunch ladies, the gym teacher, are all telling him that he's a girl. My ex-wife filed a motion to the court to limit my access to James if I don't affirm that he's a girl, to force me to use female pronouns and his fake girl's name on him, and to force me into transgender education classes, which will teach me how to parent a transgender child. The burden of proof is on me to prove my son's actually a boy. I would like to protect every child in the United States from these abhorrent practices by the medical community.
In a different time, not that long ago, maybe even a mere 5 years ago, such a position would be considered medical malpractice.
There is no medical condition where the child has the first and the last word on the care they're to receive. There's none, absolutely none. In your office, you can't even do the simplest thing without the consent of the parents. That's all changed now because of a very powerful political force at work in the world of medicine on this issue of transgender medicine. And I've actually had to give testimony on behalf of parents who were trying to preserve their custody of their own 14-year-old daughter because that daughter had fallen into the hands of a gender clinic in Ohio, and the gender clinic was recommending full transitioning, and they wanted to put a stop to it. And the courts stepped in, threatening custody, transfer of that child to another family member, which is unspeakable.
She can never go back to being a girl. I mean, she'll always be a girl, but she can never go back to being a girl in a healthy body that she should have had.
right? She's going to forever have a lower voice. She'll forever have to shave because of facial hair. She won't be able to have children. She won't have a family. These kids don't even understand what this stuff means. What kid who's 13 is thinking about a family and having children? You know, what kind of father would I be if, let's say in 5-10 years, my daughter is detransitioning and she turns to me and says, you know, Dad or Mom, like, why did none of you do anything to stop this? I was a child. Like, none of you stuck your neck out for me back then. You just let me do it because I was an immature kid thinking this was something great. Where were you on that one? When my daughter asked me that question, I'll say, you know, I did everything that I possibly could. There was nothing more I could do. And then when there was nothing more I could do, I continued on because I didn't want other parents to go through what I went through.